Hello there. My name is Pharmacist Michael, and welcome to our video on the benefits, risks, and side effects of Zofran. Zofran is a medication that is commonly used to prevent nausea and vomiting caused by chemotherapy, radiation therapy, and surgery. It's also used to treat nausea and vomiting caused by other medical conditions, such as morning sickness in pregnant women. In this video, we will take a closer look at Zofran and explore its benefits, risks, and side effects. So let's get started. Zofran works by blocking the action of serotonin, a chemical in the body that can trigger nausea and vomiting. Zofran is also used to treat nausea and vomiting caused by other medical conditions. One of the main benefits of Zofran is that it can help to prevent and treat nausea and vomiting. This can be especially helpful in patients who are undergoing chemotherapy or radiation therapy, as these treatments can cause severe nausea and vomiting. By taking Zofran, patients can often avoid these unpleasant side effects and feel more comfortable during their treatment. Another benefit of Zofran is that it is available in several different forms, including tablets, oral dissolving tablets, and injections. This makes it easy for patients to take the medication in a way that is most convenient for them. For example, patients who have difficulty swallowing pills may find that the oral dissolving tablets are a better option for them. Finally, Zofran is generally safe and well tolerated by most patients. While there are some risks and side effects associated with the medication, most patients do not experience any serious adverse effects. This makes it a popular choice for doctors and patients alike. I'm old enough to remember when Zofran first came out, and a CRNA came into my office and said, "This new Zofran is a wonderful drug. It is amazing, and it really is changing our practice." And now I see it used in the hospital as much or more than probably any other medication. Now, when it comes to dosing, it's important to follow your doctor's instructions. But here's the general breakdown. For post-surgery nausea, the typical dose is 4 milligrams by mouth, usually about an hour before anesthesia, followed by a few doses every 8 hours after surgery if needed. For chemotherapy-induced nausea, you might take 8 milligrams about 30 minutes before chemotherapy starts, followed by another dose 8 hours later. Then, it's 8 milligrams twice a day for the next 1 to 2 days. These are general guidelines, and it really does depend on the patient and the treatment being used. For kids, dosing is usually based on their weight. Children 4 years and older generally take 4 milligrams before chemotherapy, but younger kids or those with different medical needs may have specific instructions from their healthcare provider. Ondansetron can interact with other medications, especially those that affect your heart rhythm. If you're taking multiple medications, definitely have that conversation with your pharmacist or doctor. One of the main risks of Zofran is that it can cause a rare but serious condition called serotonin syndrome. Serotonin syndrome occurs when there is too much serotonin in the body, which can cause symptoms such as agitation, confusion, rapid heart rate, and high blood pressure. This condition can be life-threatening if it is not treated promptly. Another risk of Zofran is that it can cause changes in heart rhythm, which can be especially dangerous for patients who have a history of heart problems. Patients who are taking other medications that can also affect the heart rhythm may be at increased risk of experiencing these side effects. And finally, Zofran has also been associated with an increased risk of birth defects when taken during pregnancy. While the risk of birth defects is relatively small, it is still important for pregnant women to discuss the risks and benefits of taking Zofran with their doctor before starting the medication. Like all medications, Zofran can cause side effects. Some of the most common side effects of Zofran include headache, constipation, and diarrhea. These side effects are generally mild and go away on their own after a few days of taking the medication. Other side effects of Zofran can include dizziness, fatigue, and drowsiness. These side effects can be more severe in some patients, especially those who are taking higher doses of the medication. Patients who experience these side effects should talk to their doctor about adjusting their dosage or switching to a different medication. Like all drugs, Zofran can also cause allergic reactions in some patients. Symptoms of an allergic reaction can include hives, swelling, and difficulty breathing. People experiencing these symptoms should seek medical attention right away. While Zofran can be an effective medication for many patients, there are some people who should not take it. People who are allergic to Zofran or any of its ingredients should not take the medication. Additionally, patients who are taking certain medications such as apomorphine should not take Zofran, as it can interact with these medications and cause serious side effects. Patients who have a history of heart problems should also be cautious when taking Zofran, as it can cause changes in heart rhythm. And finally, as we discussed earlier, pregnant women should talk to their doctor before taking Zofran, as it has been associated with an increased risk of birth defects. Zofran is a medication that can be effective in preventing and treating nausea and vomiting. While it is generally safe and well tolerated by most patients, there are some risks and side effects associated with the medication that patients should be aware of. If you are considering taking Zofran, it is important to discuss the risks and benefits of the medication with your doctor before starting treatment. Thank you for watching, and I hope you found this video helpful. If you have any questions or comments, please leave them in the comments section. And be sure to watch my other videos on medications, natural supplements, and different disease states. My name is Pharmacist Michael. Be happy and be healthy.